Hey everyone, welcome back to another episode of Physiology 2, especially for you. In this video, sort of a bonus video to the course, we're going to look at how you can get the theory into practice. So, to apply some of these concepts, starting with the respiration, the ventilation, cardiovascular system, and then slowly we merged everything together into exercise physiology. If you want to apply that exercise physiology into practice, then you will ask yourself these kind of questions. How do I train and how do I test? So in this video, we'll walk you through a couple of practical considerations, some tips and tricks to make the transition from theory to practice a little bit smoother. So first of all, what we will teach you later in Physiology 3 and other courses is how to set up a good training plan. So it all starts in short with a good goal and then to apply the right training principles. In this example, we're only looking at two of those principles, specificity and overload. Specificity is about what do I want to train? In this case, if our goal is to focus and improve the cardiovascular system and the aerobic capacity, then we should do activities that will actually trigger that system to be active so that chronic adaptations over time are likely to occur. The second one, overload, is all about setting the right intensity because only when you apply overload, the body will adapt and will actually cause these chronic adaptations over time. So, yeah, what kind of tests can we use and how can we put some of this theory into practice? Well, there's submaximal tests and there's maximal tests. On the left, you can see a couple of maximal exercise tests, but actually the only one that is a true and direct max test would be a VO2 max test, where you actually measure the gas exchange. So you measure CO2 and O2, what you expire and what you inspire. And through these measurements, you can actually calculate how much O2 you're actually consuming and how much CO2 you're producing. That will be the only and always the best method to measure the aerobic capacity by means of the VO2 max. But then you also have like these classic tests like the Cooper test and the shuttle run test, which are maximal tests because you ask your athlete or your participant to perform to its maximum capacity. But it's not a direct VO2 max measurement. And what you see often in literature and in practice is that the maximum score of the test is used to actually make a prediction towards the VO2 max. And then whenever a prediction is concerned, you have to realize there's always a large margin of error, an error in the prediction. So by always, if you have the possibility, definitely always go for a true max test, trying to measure someone's true VO2 max if you're interested in aerobic capacity. 6-minute walk test or the 10-meter walk test would also be considered max tests, but if they are used to get an idea or a prediction of aerobic capacity, then the quality of those tests is relatively low. On the right, you can see some submaximal tests, and definitely the two most classic and famous ones are the Austrian bike test and the Harvard step test. Both tests are submaximal tests because you let your participant perform at a submaximal intensity, and then from those submax values in comparison to other data, you try to predict someone's VO2 max. So again, it's a prediction, so it is always best to go for a maximal exercise test because these submaximal tests are relatively low in their validity and reliability. Only in a few specific cases I can recommend them if you have no VO2 max possibility available. Of course, they are useful, especially within one person. They are more useful than in the comparison between participants. I'll give you an example when we go through the protocol in a second. Now, the maximal exercise test, what you can see right here, is a video of me from many years ago where you see that I'm wearing a mask, and through that mask, the VO2 is actually measured. So the amount of O2 that's going in and out is constantly monitored, and the same for CO2. And then by measuring those differences, you can actually calculate someone's VO2 max. And the idea of this graded exercise test is that you actually slowly push the participant let's say between 12 and 15 minutes, to their maximum by gradually increasing, in this example, the inclination of the treadmill and the speed of the treadmill, usually in steps per minute or per 30 seconds at some point. And then you gradually increase the intensity until the participant is no longer able to maintain that intensity. And then if you see the VO2 levels also reaching their plateau, leveling off, you're pretty sure that you have reached your VO2 max. In later courses, Physiology 3 and Physiology 4, we will focus a lot more on the actual practical implications of the test, the execution of the test, but it's good to already have an idea about the general concept. Now, so why do you want to have someone's maximum capacity? That could be the VO2 max in many cases. Like I said before, aerobic capacity is usually measured through VO2 max. That is still considered to be more or less the golden standard. But also heart rate max or maximum workload, in case the max test was done on a bike, could be interesting variables to use later on. And why you want to use them is actually for two reasons. You first want to have a good assessment, and especially for evaluation purposes, a max test is relevant as a baseline measurement, 10 weeks post-training, 20 weeks post-training, or post-op. In any case, you can have a nice comparison if you have high-quality measurements at different points in time. But the second reason is also very important, because from this baseline value, you can actually set the intensity of your training program. So, for example, if you know someone's VO2 max, you know someone's aerobic capacity, then you can use guidelines to help you set the right intensity. If they state you have to train between 60 and 80% of someone's VO2 max, you can calculate from those true values what percentage how that percentage would translate to actual VO2, and then you can actually dose the exercise more specifically and more accurately, because it's all based on someone's true capacity. But if there's no max test available, then yes, of course, sometimes you want to do a sub-max test. Now, the Östrand bike test, similar to the Harvard step test, is all based on steady state exercise that you execute for, let's say, 6 minutes. So the idea is that in the first couple of minutes after you start the exercise, the heart rate and the VO2 will gradually rise until they reach a steady level. And then the steady state heart rate is what you're going to use to actually use the nomogram to connect the heart rate to the intensity, and then reading the VO2 in the middle. So it's a visual algorithm, or it's an algorithm that's basically visualized through the nomogram. That's the best way to put it. It's based on many assumptions, so that's why the margin of error in this prediction is definitely large. That's what you have to realize. For example, it's based on norm data of other people measured in the 50s or in the 60s. Which is not the main reason why it's an issue. Physiologically, not much has changed, most likely in the last 60 years, but definitely norm values for the original nomogram were based on relatively young people, between 20 or 25 years old. So that's why the external validity of some of those tests and some of these nomograms is somewhat limited, because it was not a very heterogeneous population, for example. But the whole idea is that you use someone's submaximal heart rate to predict the VO2 max accordingly. And what this is based on is the fact that we know from literature that there's a linear relationship between heart rate and VO2. So what you see in this graph is that here, if you have the measured heart rate, and here you have VO2, the idea of these kind of submaximal exercise tests is that you give someone a fixed workload. So 150 watts of biking, for example, would be the equivalent of a certain amount of VO2. So if you ask someone to exercise at a certain VO2 and you measure someone's heart rate for that specific intensity or activity, then the idea is that because you know this linear relationship exists, you try to extrapolate this relationship from the submaximal values to the maximum values. So you would have to know, or again estimate someone's heart rate max to be able to extrapolate this relationship through the submax values towards finally VO2 max. So you can already hear in my explanations, without mentioning all the other potential confounding factors, that there is a big risk that the prediction is quite far off. But if there's no alternative, of course, it might be better than just picking a number out of the blue. But especially if you compare between individuals, please be very careful with these kind of extrapolations and predictions based on assumptions and norm data. But if you compare within one person, definitely if you do the submaximal Östrogen bike test in, for example, 0 weeks and 12 weeks, then the comparison is definitely a lot more valid. Well, so in physiology and exercise physiology, of course, there's a lot more tools that you can use to either assess or evaluate or maybe monitor training. Borg scale was already briefly mentioned in earlier videos, but definitely a measure that you can use later on in setting or guiding patients through exercise and training. Heart rate monitors we will get to, breathing gas monitors we've mentioned already, saturation devices, spirometers, and also sphygmomanometers, devices that can measure blood pressure. At some point in your career as a physio will definitely be useful to monitor or to measure your patient's values. So there's two purposes. Again, there's how to measure intensity and there's the question how to set intensity. And when it comes to the aerobic system, then basically VO2 is a great variable, heart rate is a great variable, and Borg scale is a potential variable. Borg scale we will not focus too much on right now. VO2 is not very realistic in many cases of actual patient monitoring because you don't have those tools for regular training. So that's why in this example, we'll show you a few applications of using heart rate for both the measurement of an actual intensity that is already performed versus calculating at which target heart rate someone should perform in order to set the right intensity. So from theory to practice through heart rate monitors, but definitely when you look at heart rate at rest, please also consider just using your manual method that sometimes will do the work just fine. But one of the reasons why heart rate is a better measure than, for example, running speed, if you want to set the intensity, is because in this example you can clearly see that if you let two people run at the same speed, it's not by definition the exact same physiological load. For example, if you take a very tall person and you let that person run with a very small person, then the actual intensity physiologically is different even though they run at the same absolute running speed. So the heart rate in this example is a better reflection of the actual intensity that these people are running at. So that's also in future applications the way for you to be just a little bit more objective by using heart rate and not relying on just the external workload, for example. But how do you then use those numbers in the best possible way? Well, what you can see here on the right is basically a speed monitor. And the heart rate is definitely a great way or a great method to use as a speed monitor. But then according to the heart rate reserve method, and preferably not with the percentage of heart rate max method, for example. In short, the heart rate reserve is just basically the whole scale from resting heart rate all the way to maximum heart rate. And if you know someone's true scale, so the complete heart rate reserve, then it's a lot easier and more accurate to pinpoint the intensity somewhere on that scale. For example, if a person has a resting heart rate of 70, then his scale will be different from a person that has a resting heart rate of 50. So you really want to use the full scale. And then the formula to use for this would be to take the heart rate of an actual exercise, you subtract the resting heart rate, and then you divide that number by the entire range, heart rate max minus rest. And that is then a percentage of the complete range. So 50% would be exactly in the middle, like this one shows right here. 50% between 70 and 170 should be 120. So that's a quite objective way to use both maximum heart rate and resting heart rate, and then to indicate what percentage is someone exercising at. Another practical application of heart rate is of course, first of all, the submaximal heart rate at any given intensity, similar to the Austrian bike test. The whole idea is that after training, after a solid 10 or 20 week of aerobic training, you would expect for the same running speed, for the same biking workload, the post-training heart rate values to be slightly lower than the pre-training values, and that is then an indication of an increased stroke volume. But it's not just during exercise that you want to monitor heart rate. Already at rest, heart rate can give you a lot of important information. So for example, in this graph already you can see a couple of values, although these will not reflect the true resting values. If you would be measuring someone's true resting values, you would actually expect the post-training values at rest for heart rate to be lower than pre-training. So if you monitor resting heart rate, you can already monitor indirectly stroke volume changes. A second application of checking the heart rate at rest would be to monitor signs of overtraining. Also very common in athletes and also potentially a risk for patients. So if you know that someone's resting heart rate is always between 50 and 55, and then if at some point your patient comes in with a resting heart rate of 60 or 65, and there's no other reasons for this higher heart rate, it might be a sign of overtraining, for example. So this is a way for you to constantly monitor what is normal, what do I expect. So again, this is where know your numbers is my favorite message to you as a young physio. Please know your numbers, so then it's a lot easier to know also when something is slightly off. The next application of heart rate would be to look at recovery. So even though the intensity or the heart rate during any activity is still the same between two people or between now and 10 weeks ago, recovery definitely also gives you a good indication of someone's overall capacity. Because what we know from people that are well trained is that they usually show a lot faster recovery, as you can see here in the blue line, reaching their resting heart rate a lot faster than pre-training. So also the time that you need for recovery is an indirect indication of someone's overall capacity and a potential training effect that you want to monitor. So those were just a few examples of how you could use heart rate in daily practice. Definitely also something I would like to encourage you is to watch the news. And in the last couple of years, there have been quite a few stories. And in the next slide here, I've picked two examples that really show an interesting story where you can use some of your exercise physiology in making your final judgment and maybe get your final opinion for yourself. Over on the left, you can see a screenshot of a video. It's a Dutch documentary, so if you need to practice some Dutch, then definitely this is also a good way. But it's a great video about back in the days when Ajax was playing Juventus for the Champions League. Then there were serious doubts about the Juventus players being under influence of blood doping of any kind. And in this documentary, you can nicely see how they have, at least in retrospect, analyzed the situation and realized that some of those improvements that were stated at first could not be expected to be normal improvements, because normal training effects would go the other way around. For example, when you were looking at the hematocrit value. So if you're interested into football and definitely interested in exercise physiology, then this is a great video to explore. But again, you have to know some Dutch. On the right, you can see, I think it was an Austrian athlete that was caught in the middle of a blood doping act. So there was absolutely no excuse possible, no way to get out of the situation. Painful for the person, but definitely also a good example that these practices definitely occur. And from an exercise physiological point of view, also very, very interesting to analyze. So just look at the video. There's a short video with a nice article about it to show you a little bit more about what's happening behind the scenes in many of these professional sports. All right, We're almost there, so this course is completed, but definitely you are expected to move forward and to put everything into practice into physiotherapy interventions when you really want to focus on training, and also in clinometrics and in other courses where you have to do the right exercise testing and especially be able to interpret those results for real patients later on. Physiology 3 will actually be the next course where the healthy sports-related exercise physiology will be on the menu. And then following that, we will finish it off with cardio and pulmonary patients in Physiology 4. So the last thing of this video that I would like to have you remember, hopefully, is this quote from Kurt Lewin, a social scientist from 1985. He made this quote, and I think it's perfectly applicable to this video. There's nothing so practical as a good theory. All right, that was really it. I want to thank you for watching, and I hope to see you in a next video.